8 countries in Southern Africa have come together to discuss measures to combat gender-related killings. This comes a month after President Cyril Ramaphosa signed into law a bill to establish the National Council of Gender-Based Violence and Femicide to ensure the safety and security of women and children. Let's now bring in gender activist and gender-based violence researcher at Wits University, Veton, and Dr. Lesley Ann Foster, who's founder and executive director of Masimanyane Women's Rights International. A very good evening to you both, and thank you so much for your time. Perhaps, Lisa, let me start with you. I mean, 8 countries in the Southern Africa coming together to find ways and engage in discussions to combat gender-related killings. It's an encouraging step, isn't it? But can it be effective?
It is necessary, because if you don't map the problem, and if you don't sit down and think about what are the ways we're going to try and prevent this, and then put in place measures to assess whether or not your strategies have success, then you're really just shooting in the dark and hoping that if you do a little bit of this and a little bit of that, it's going to have some effect. It is important to bring people together and also to try and learn from each other. I mean, South Africa developed its strategy in 2022. So I think now is an important time to start reflecting on how is that strategy going, what can we learn if we present it to other countries, what are their thoughts on it, are they trying something similar, or are they doing different things which might be having different results. So it's always good, I think, to try and compare and learn lessons from one another and strengthen and look critically at what is being done.
And of course, it's important as we listen to the package by my colleague Griselda Lewis there, speaking about how the time to talk should now be over. Doctor, just listening into this, how much can collective action move the needle as we consider the components of the most promising way forward for a lasting impact?
Well, I think the important thing about this gathering is that we need political will to start off with. And this demonstrates political will. The problem is that gender-based violence, and particularly and femicide, which is a part of gender-based violence, is driven by inequality within our society. And unless the political will extends to addressing the inequality that women experience across the African continent, across countries in the South, we won't see gender-based violence diminishing in any significant way. So the political will needs to move beyond the rhetoric of, suggesting that the political leaders are actually addressing this issue, into really having the commitment to address inequality, particularly gender inequality, because there are many aspects of inequality that affect men and women differently, but gender-based violence has its roots in the inequality which we have in our society. And our finding is that across the country, there's a lot of lip service that's played to addressing gender inequality, but there's no real will from both civil society organizations and the state. So the state will say that they, going to address this issue, and in the implementation they fall short. So the way in which the police responds to it is grossly inadequate across the country. The way the whole criminal justice system is established is not responsive to addressing this issue. But the main thing is around prevention, and prevention is not awareness-raising programs only, marches and lighting of candles. It's really tackling the unhealthy norms and standards in our society that relegate women to a lower status than men. Unless we address that, this problem will persist for centuries to come.
Yeah, absolutely. Lisa, as we take stock of that, just looking at inequality, looking at prevention, as we also scrutinize the numbers and the impact of GBV, it's often said that the figures can be significantly higher if we now have to consider how stigma and shame silence women and girls, preventing them from disclosing violence and now looking for help.
That's certainly true. I think when we're talking about police statistics in relation to things like rape, different forms of sexual violence and domestic violence, we will need things like community-based surveys in order to understand that. I think when it comes to femicide, it is a somewhat different picture, because there, unfortunately, you have a victim in the true sense of the word, somebody who cannot speak. And a body is a very inescapable form of evidence of violence. So I think our figures around femicide tend to be the most reliable of all the different forms of gender-based violence. Although I think one sees some differences sometimes in what the police present and what researchers find it more true. And there is a real need, I think, to look, I would say, to take an historical view of the data that we are collecting, so that we can also get a sense of how things are changing over time. Because if we look at femicide in South Africa, we can see the 1990s having been a high point. We can then see the figures decreasing over the next 10 and a half years. But then we see something very disturbing start to happen around about 2021, 2022. We see women's figures, which have remained more or less constant for, say, a decade, suddenly start an up curve and an increase. Now, that is very concerning. That needs to tell us that something has gone very wrong, that decades or whatever it is we were doing was having some kind of preventative effect, but it's not having that effect any longer. And that is a call to us not to, I think, engage in some glib statements about all standing together, but about looking at what is it that has changed in society. Because I think a phenomenon like murder or femicide doesn't just rely on relations between men and women. It also looks at what is it that changes those relationships between men and women. Sometimes, of course, it can be changes in the economy that will shift relations between men and women, may exacerbate inequalities and difficulties. So it's really important that we look at how do things come together at different points in time to increase or decrease violence. It's also really important that we pay attention to the different provinces in the country, because the picture can look quite different. The Eastern Cape, for example, the last time we had data suggests that women in the Eastern Cape are somewhat more likely to die at the hands of acquaintances and strangers than perhaps their partners. But move to the Northern Cape and you find that women there, and the province is just next door to the Eastern Cape, almost 2/3 of women are killed by their partners, and a far smaller percentage by acquaintances and strangers. So you've also got to get grips at what are the regional dynamics that are also fueling and shaping inequalities and reactions and the use of violence.
Absolutely. Dr. Foster, as we take stock of what Lisa's talking about, really just speaking about the value of demographics and research and trying to get to an understanding on the factors and what has changed in society when it comes to the relations between men and women. What stands out for you as we note the trends and also just looking at the highs and the low points in scrutinizing the behavior?
Yeah, I think one of the issues that has been made visible through and related to what Lisa's speaking about is the impact of COVID. Globally, we are still measuring the impact of COVID on the lives of people. And in that that period, women were in isolation. The levels of violence against women, gender-based violence reported went up, and also femicides started to increase. So, big events like that can cause that. I think also what we really need to focus on is economic inequality, because there's a direct link between economic inequality and increased levels of gender-based violence. So when Lisa speaks about the Eastern Cape, we are the poorest province. The poverty has deepened in the most recent reports that have been shared weekly and recently, and that causes the women to be more vulnerable to the risk of gender-based violence, and particularly femicide in the province. So it's a very important reflection on what the demographics are in different areas. But at the same time, if you look at the Western Cape, which has the highest murder rate in the country, you'll see that femicide levels there are high as well, irrespective, of the fact that it's a much more wealthy province. But I think there again, you have to look at where the inequality is, who the particular women are, and what their access to justice is, in these different areas. The other thing about rural provinces like the Eastern Cape is the distance from any kind of service, whether that be a clinic or a police station, is so far removed that it's almost impossible for people, to get that kind of help. And if you look at an area like Lusikisiki in particular, where there's such extremely, and it's been the highest levels of violence in the country for ever so long, the inequality is very deep. The lack of the illiteracy levels are high. There are many factors, the economic factors, the literacy levels, the access to services, all of those things are compounded, to increase the vulnerability of women and girls in those areas. So it's not a simple answer to why we have these high levels of violence. But I think that, and we don't have enough information, as Lisa, alludes to that. We need many more research reports and surveys, as she has said, to give us a better understanding of that. And I think the way in which we're responding to it at community level often doesn't help. When we have banners that say stop femicide, stop the killing and so forth, but that doesn't have depth and it doesn't have breadth in terms of being able to address the issue. And I think that we need a solution that's political. We need a solution that is driven by civil society, adopted by civil society, and we need to address the economic disparities that people face in our country. And I want to make this point as well as that a lot of the gender-based violence that we're facing in the South is driven by the geopolitical context and by the international financial architecture, which is the World Bank, IMF, and so forth. Their policies force austerity measures on our country, and inevitably those austerity measures are a cut in health, in education, in housing, in all the elements that come together to provide protection and safety to communities. That's where the main cuts are. And so we have to make that global link as well, and why particularly in the South countries are facing these problems. The debt crisis is not delinked from what we are facing as a whole in the country, the deepening poverty, and the inequality. So we need to make all of those linkages to get a real comprehensive picture of why we have the problems we have.
Yeah, absolutely. Lisa, just rounding off our conversation, what kind of a sectoral approach would you think is needed as Dr. Foster talks about the kind of depth that needs to be looked at?
Well, I think you would want to look at communities in terms of things like how do you intervene when you see acts of violence. I think very often sometimes people may actually see violence unfolding in front of them. What do you do when you see that? How do you intervene and how do you stop that? We need to look at things like social services. What is available? Are there sufficient numbers of shelters? Do health facilities know how to identify? Very often women go to casualty. They get their Panado, they get their stitches, they get sent home. She doesn't ask who injured them. The nurse doesn't say, many women in your position often live in dangerous and difficult situations. Here's a pamphlet referring you to a shelter that will tell you more about domestic violence if you ever need this help. We need well-informed, supportive court personnel. We had the public protector release her report just last month, talking about maladministration, the courts talking about the shortage of clerks and magistrates and the lack of planning. Very concrete sets of suggestions around what needs to be done, I think, within the court system in order to tackle the problem. But I think there's also the questions of looking at, as Lesley Ann has started to suggest, these questions of budgets and funding. Because services don't just support themselves. They require commitment to say that this is a priority and we're going to put money into this. So it's an architecture that requires services, communities, funding, plans, just enough sufficient courts, for example, sufficient shelters, if we're going to talk about a comprehensive response. And it's got to think about domestic violence as a starting point of violence, as the starting point, all the way through to its most lethal form when it culminates in a homicide. So how do we, across that violent trajectory, intervene in order for it to never reach that point where somebody does actually die?
Yeah. Absolutely. Thank you so much for both weighing in this very important conversation. Speaking there to gender activist and gender-based violence researcher at Wits University, Lisa Veton, as well as Dr. Lesley Ann Foster, who's the founder and executive director of Masimanyane Women's Rights International. Thank you for your time.